Welcome to Beyond the White Coat. I'm Kerry Briggs. This is my new channel, and if you are interested in why, you have to go back to the first episode and it will tell you. So, Beyond the White Coat, today we're going to be talking about the flu, and we're going to talk about some natural solutions to the flu. Before we begin, the information on this site is for educational purposes only and the opinion of the author. This is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician with any questions that you may have regarding medical conditions. All right, so the flu, influenza. It's a this is a definition, it's a common respiratory illness from the influenza virus. So I think it's important that we define what a virus is. It is actually from a Latin word, and this is the only meaning of the word. From the Latin, poison, especially snake venom or just venom. That is the Latin definition of a virus. So, symptoms of influenza, I'm going to talk about some, and then we're going to talk about a whole bunch of them. Symptoms include fever, headache, body ache, cough, stuffy and runny nose, and you are at risk for serious complications if you have underlying health conditions or are pregnant. According to the Cleveland Clinic Foundation, getting the vaccine every year is the best way to avoid getting sick with the flu. And we're going to talk about that, and I'm in some disagreement with that statement. And this was pretty much outside of the actual definition of virus, was from the site of the Cleveland Clinic, and a lot of the information is from the site of Cleveland Clinic, from some studies, and from drugs.com. So, other symptoms that you can have is sore throat, sneezing, tiredness, shortness of breath. So the flu season is from October to May. It's worst December to February. So who's at the highest risk for flu infections is those with asthma, COPD, or other lung diseases. If you have a history of kidney, liver, or some neurologic symptoms, you're at a higher risk. If you have heart problems, blood vessel problems, even up to had a stroke, neurologic conditions can be where you can't clear the phlegm that's going to be produced from the flu, and just some different things like that. If you have diabetes, sickle cell disease, you have a weakened immune system, as in you have HIV, cancer, or you're on some immunosuppressant drugs. And one of the there's a lot of them. If you have skin conditions, all the newer medications out, most of them are immunosuppressive drugs, corticosteroids like prednisone, dexamethasone. Those are also immunosuppressive drugs. If you have a BMI of over 30, in other words, you're obese, you're at risk. And according to the Cleveland Clinic, if you're under 5 or over 65, pregnant, or under 19 years of age and take aspirin regularly, or that you live in a long-term care facility, then you are more susceptible, you are at a higher risk for the flu and complications. So how many die from the flu each year? So if you go to the CDC website, they will say between 20 and 50,000 people die of the flu. And if anyone projects that, that's a lie. That is not true. If you look at the whole document, what they say, the 20 to 50,000 deaths come from respiratory infections. Well, that includes pneumonia, RSV, and any other upper respiratory infections. But they say, from the flu. Well, if you go to the back of the documents from the CDC, you will see that they break it down. It's not just in a big category of like respiratory, but they break it down into those who died of pneumonia, who died of RSV and the flu. And 99% of those who die are not dying from the flu, they're dying from pneumonia. The flu is generally 20 to 25. Now, this is going to be a shock to some of you, and you're going to go, whoa, this is like way different. Yep, it is. Because they lump everything together, and then they want to scare you because they want you to go get a vaccine. Who kind of controls CDC Pharma? Oh yeah. So if you go to the back of the document and where they actually break down each one, like respiratory, cardiovascular, and neurological. If you go to the back of the information, and it actually tells you how many died of RSV, how many died of pneumonia, how many died of flu, how many died of heart failure, how many died of AFib, how many died of, and on, then it breaks it down, and the number is extremely low from those who die of the flu. Most people will die of pneumonia when it comes to upper respiratory. And this is in their document of morbidity and mortality report. They used to do it yearly, but now they do it monthly, so it's a little harder to track. So the CDC says that steps to prevent the flu: get a vaccination. If you're 6 months or older, you need to get a vaccination. But the vaccination, even in our own documents, and we will discuss it, does not prevent anyone from getting the flu. And actually, last year, Cleveland Clinic did a study of their employees, which is 53,402 employees, and it showed that those who got the vaccine last year were 27% more likely to get a flu infection than those who did not get the vaccine. So if you got the vaccine, you were more likely to get the flu. Let that sink in. They also will say that if you get the flu and you have the vaccine, it will lessen your symptoms. But there's really no definitive data on that. That's just what they project, just like the 20 to 50,000. Like, really? Is that really true or not? So, should you get a vaccine? You need to get one that's free of thimerosal. Thimerosal is mercury. So If you decide, well, I'm at risk or I'm going to get the flu shot, ask your provider, does it have thimerosal in it, which is mercury? You do not want that. It is not recommended. And the reason I'm saying this is that there are 265 different brands of flu vaccine. So, do you know when you go to your doctor which one you're getting? Does your doctor know which one you're getting? Or has it just been supplied to his office? Does your doctor know? Is it free of thimerosal? Does your doctor know which and what the side effects are of that? I'm going to say probably generally they know some of the side effects, but they don't know a lot of the side effects. They just don't. So Fox News in 2025 reported that the flu vaccine was actually linked to higher infection rates. That's interesting. So, what is the vaccine? The vaccine is made from killed virus. Now, remember, the definition of a virus is a poison or a venom. So, how do you kill a poison or a venom? I don't know. So, drug.com states that like any vaccine, that's important. Like any vaccine, influenza virus vaccine may not provide protection from the disease in every person. So the key here is like any vaccine. In other words, all the vaccines are the same. All the vaccines, just because you get the MMR doesn't mean that you won't get mumps, measles, or rubella. Just because you got the COVID vaccine, we know that you got people got the vaccine and got COVID. It does not prevent. So the same can be true from HIV, polio, pneumonia vaccine, shingles vaccine, and on and on and on. I know people who I have seen and treated people who got the shingles shot, and less than a month they came in with the shingles. So you have to ask yourself, what are these vaccines and are they really that beneficial, and do they really work, and how do they work? So we're going to talk about some of the flu vaccines, some of the side effects, and this is according to drugs.com, who breaks it down very well. So we're going to go by categories. Cardiovascular, 1 to 10% who get the vaccine will have chest tightness, myocarditis, which is an inflammation in the muscle of the heart, which has become big after COVID. That myocarditis was one of those things that it produced. So after this, and this was all discovered before they stopped testing on it. So they will test a certain amount of time, and then they no longer will give tests, but there's what's called a post-marketing, which means that now it's out into the public, and these are reports that doctors are sending to the CDC of side effects that they have found. So anytime I say post-marketing, that is after all the studies and the data collection is done, and now doctors are reporting, well, I have patients with this. So post-marketing of the flu vaccine in regards to cardiovascular, chest pain, swelling of the injected limb, tachycardia, vasculitis, and this is potentially associated with transient renal involvement. Dermatologic, 1 to 10% have facial swelling, a rash, sweating. 0.01 to 0.1 have pruritus, which is itching. Night sweats, urticaria, which is rash, or hyperhidrosis, which is all of a sudden you just profusely start sweating. Marketing, dermatologically, angioedema. Angioedema, we talked about this when we talked about lisinopril, is a swelling in the tongue, the mouth, the airway, and it can be anywhere from very minor to life-threatening and has caused death. That is your vaccine. It can post-marketing also, they had cellulitis. They had a generalized rash. They had Stevens-Johnson syndrome, which is where you get blisters all over and a rash, and your outer skin basically sloughs away. Not fun. Gastrointestinal, 10% or more get diarrhea. 24% have vomiting. This is from the vaccine. And 14.8% have nausea. So the common side effects are oropharyngeal. You're in your mouth. You have pain. They describe it almost like teething. Post-marketing for gastro is abdominal pain, dysphagia, which is difficulty swallowing, and angioedema. So hypersensitivity, that is an allergic response. So you have an allergic reaction to it. And there were reports of that prior to, but post-marketing, they even had an allergic responses up to anaphylaxis, anaphylactic shock, which if not treated quickly and appropriately, you die. This is the same kind of concept that when people are allergic to bees and they get stung and they have an anaphylactic reaction, that's what you're talking about. Then also post-marketing is a serum sickness. This usually occurs 7 to 14 days after the exposure in your body to a foreign protein such as antivenom or certain medications. One of them is penicillin. Immunologic. It can cause influenza B infections, and it's called vaccine failure. So you get the flu shot, and it's supposed to cover you for influenza A, B, and then they throw some other stuff in there based on what comes out of Australia. And so you get this vaccine, and then you end up getting influenza B, and you actually get it from vaccine failure. You get it from the vaccine. Metabolic is very common, is a loss of appetite up to 32% of people. Change in your eating habits, and that goes up to 21%. Local, that's the injection site pain, swelling or lump, and that's kind of all they had before. But once we're done collecting the data post-marketing, then there were reports of cellulitis and sight rashes and swelling to that extremity. None of these sound like a lot of fun. Musculoskeletal. Muscle pain up to 36% of people who get the flu vaccine. Joint pain and up to 13%. Some common ones, which was basically a 1 to 10%, you get chills and shivering. And less common is 0.1% to 1% is muscle weakness. Post-marketing, here's some interesting ones. Abnormal gait. You can't walk straight. You're having trouble walking. Arthritis, extremity pain. Decreased movement in the injection limb, meaning that if you got the injection in your left deltoid, now you're having trouble moving your left arm. Respiratory. Very, very common ones are rhinorrhea, 11%, cough, 10%. Common ones, which are 1 to 10%, croup, nasal congestion, sore throat, upper respiratory infections, and then frequently bronchitis, bronchiolitis, pneumonia, pulmonary congestion, shortness of breath. I thought we were getting this so that if we got the flu, we wouldn't get this kind of stuff. This is from the vaccine. These are side effects from the vaccine. These are not you got the flu. These are from the vaccines. Post-marketing. People now report that they have asthma. They have bronchospasm. They have shortness of breath. Dysphonia, which is basically your laryngitis. You can't hardly talk. Rhinosinusitis, throat tightening, tonsillitis, wheezing. These are all from the vaccine itself. I keep saying that because this is long, and I want you to know that we're not talking about the flu right now. We're talking about the flu shot. Ocular, 1 to 10% get red eyes. Post-marketing, conjunctivitis, eye irritation, eye pain, eye swelling, optic neuritis, which is inflammation in the optic nerve, which can cause difficulty with seeing. Most of the time it is limited, but it can happen. And photophobia, like bright lights. Psychiatric, irritability, up to 54% who get the vaccine have irritability. I'm old and cranky. I don't need that. Abnormal crying, up to 41%. And uncommon side effects are moaning and restlessness. And post-marketing, reports of insomnia. Nervous system. Drowsiness, where'd it go? I moved it. Drowsiness up to 37%. Sleepiness up to 35%. Headache up to 30%. So almost 1/3 who get the flu vaccine will develop headache. Uncommon is lethargy, which is a very misunderstood term, and vertigo. Yeah, I'm going to leave that there. Rare from in the nervous system is dizziness, paresthesias, which is numbness, tingling in your extremities or your face. Somnolence, which is you can't stay awake, you want more sleep. Frequently but not reported is febrile seizures. Then you go to post-marketing and straight out seizures, encephalitis, facial nerve palsy, which is like Bell's palsy, Guillain-Barré syndrome, which is a nerve issue generally in one leg, one side that just kind of marches up, and some of it sometimes it's goes away, sometimes it's permanent. And just a category of other. Pain up to 59%. Malaise, which is body aches, up to 38%. Fatigue, up to 22%. Ear infections, flu-like symptoms, fever. Flu-like symptoms. Are they saying that I have the flu if I get the flu shot? But no, they say you can't do that, but maybe you can. And frequently not reported, or the frequency is not reported, even death. So that's the flu vaccine, and that's from drugs.com. It's not my opinion. That's straight out from them, that this is what flu vaccines, these are the side effects. So one of the main drugs that is used is Tamiflu. I will tell you I am biased. I hate Tamiflu. I think it's an awful drug when you find out how it works, and how little it works. It's like, if you're healthy, why are you doing it? It takes so little out of the whole process of the flu. The flu sucks. You get the flu and it's awful. Yep, it is. Tamiflu comes with a lot of side effects. And most of the other medications, I'm not going to go through them all, most of the other medications have this same kind of side effects. And I don't like it. The thing that irks me the most about it is that doctors, nurse practitioners, physician's assistants are not honest with their patients about the side effects. They don't talk about them. They're like, you got the flu, take some Tamiflu. Well, doctor, what are the side effects? Well, you just need it, take it. And they do not tell their patients, okay, Tamiflu is available, here's the side effects. Xifluza is available, here's the side effects. This drug, here it is, this is the side effects. They don't tell them about the side effects. Well, I'm sorry, but the day of just believing your doctor has your best in mind for them is pretty much gone. Yep, pretty much gone, in my opinion. Because doctors are, and some of it's the pressure that they're under, they have to push people through, but they're not doing their job. They're not telling people. They're just saying, just take it, just do it. And I've talked about this before. I've had patients come in who like, why are you on this medication? Well, I don't know. My doctor told me to take it. Well, did he tell you? He didn't tell you why you're taking it? No. Did he tell you any of the side effects of it? No. So you're just taking it. Yeah, my doctor said to. If that's your doctor, you need a new doctor. I don't care who the doctor is. If that's your doctor, get a new one. So anyhow, Tamiflu, some of the side effects: headache, seizure, colitis, which is an intestinal inflammation which can cause diarrhea, cramping, vomiting, hemorrhagic colitis, which is bleeding. Up to 10% have nasal congestion. This is from Tamiflu. not the flu. This is from Tamiflu. And the reason that this is important is because, and I've had patients say that, and I'm like, no, I don't do that. Like, I will prescribe Tamiflu, but you're twisting my arm. But I am going to tell you all the side effects to Tamiflu, and then you can make your decision if you're an adult. And if you decide that, then fine. I know providers who have said, well, here, let me give a prescription to your husband or to this person, because you had the flu and you're around them, and it's a preventative. It is not. It is not a preventative. It is not going to prevent them from getting the flu. So now you're taking a medication with side effects that you may not even need because you don't have the flu. But what can it cause for you? Headache, seizure, colitis, cough, bronchitis, and 10%, up to 10%, so 1 to 10% will get the flu from Tamiflu. So that person that you're saying here, well, you take this because you're exposed. Well, you may have just given them the flu, because 10% people get the flu from Tamiflu. Sore throat, sinusitis, pneumonia. Take Tamiflu and have a side of pneumonia with it. Up to 10% have insomnia. Some people reported mania, which is like hyper active, hyper out there, delirium, hallucinations, anxiety. This is all taking Tamiflu, and nightmares, and sometimes called night terrors, where you just wake up, the dream is so vivid, and that. Here's one that was shocking to me. 1 to 10% of people will develop herpes from Tamiflu. What? It's in the literature. 1 to 10% develop herpes. Tamiflu can cause influenza-like symptoms, illness, sepsis, which means you have an infection that is so bad your blood pressure is dropping out, you become your lactic acid is up and you're in trouble. Conjunctivitis, facial swelling. This is all from Tamiflu. So you can see we've gone through what the flu is, what the vaccine is and does, what Tamiflu is and does. So now we're going to just talk about some natural ways that you can help fight the flu prior to getting the flu and or if you get the flu. And these are studies that have been done, medical studies, double-blind, peer-reviewed studies that natural means by which you can fight the flu yourself. The first one is black seed oil, and what the black seed oil has been shown to do is it blocks viruses replicating. So if you're taking black seed oil and you get the virus, then the replication of that is what continues the illness and makes you feel worse, and that black seed oil helps to block the reproduction of the virus. Vitamin A has been shown to increase cell immunity in the respiratory tract. So if you have lung issues, you should be upping your vitamin A. You have to be careful with that one, but upping your vitamin A, and it helps in the respiratory tract specifically, other places too, but in there. Um, it will also help you, say you decide, well, I'm going to get the vaccine. I'm ill. I'm going to get the vaccine. I'm going to take the shot. Vitamin A will actually help you make more antibodies to uh, actually fight the flu, should you get it. Because as we've seen, the flu does not prevent, like like all vaccines, does not prevent you from getting the flu. Here's one that I really liked. Vitamin C. So this is a study that was done. It was groups of people, and they had a control group and all this. So when they got flu-like symptoms and they got the flu, one group did 1,000 milligrams of vitamin C every hour for 6 hours, and that resolved the flu in nearly half of the subjects in the trial. For the other half, a little more than half, did not, but lessened their symptoms. And those who then still had symptoms repeated that same thing, 1,000 milligrams every hour for 6 hours for 3 days total. All but like 4%, when they got through that part, that were symptom free. Um, if you if you get past that 3 days and you still have some symptoms, then you drop back to 1,000 milligrams a day. So you would, if you had it the worst case scenario, you would do 3 days of every hour taking 1,000 milligrams for 6 hours, and you do that for 3 days, and then day 4 and on until you're completely done with the symptoms. Then the next, after those 3 days, you would take 1,000 milligrams a day each day out of that. So let's say you had the 7 days. First 3 you're taking 6,000. First 3 days you're taking 6,000. Day 4 through 7 you're taking 1,000 a day. Vitamin C also reduces the common cold in 10 different trials, that taking vitamin C in a randomized double-blind studies, peer-reviewed, has shown to reduce the common cold symptoms. Another one is zinc. Zinc also helps to inhibit viral reproduction, or viral replication is the real terminology. And then the last one is N-acetyl-4-cysteine. And this has been shown to reduce mucus in the lungs, and reduce flu A by 20%, flu B by 30%, RSV by 10%, and it reduces the replication of viruses anywhere from 10 to 30%. So those are some natural things that you can do to combat the flu. If you're a healthy individual, these are some tools that you can have in your own back pocket. You need to understand what we're saying here is I'm not telling you don't get the flu shot, do get the flu shot, don't take Tamiflu, do take Tamiflu. I'm telling you that this is the reality of the vaccines. This is the reality of Tamiflu. This is the reality of some natural means to combat the flu. But this is a decision that you have to make and that you should make in conjunction with your provider. And you should ask questions. What are the side effects? What of the 265 vaccines, what vaccine are you giving me? And does it have mercury in it? And what are the side effects? And on and on. You have to be your own advocate for your own health and the whole process. So I hope this has been helpful. There's going to be a lot of people that don't like this, and I'm fine with that. Feel free to message me, whatever. But you know, this is the reality of the flu and the vaccine and the treatments. Again, the information is educational purposes only. Most of it is documented. Some of it is my opinion. Seek the professional advice of your medical provider on treatments, advice, diagnoses, and let's all live healthier.